and Executive Director for Piedmont Healthcare, Dr. Jane Morgan. Dr. Morgan, great to see you. So let's begin with Amy Schumer's condition and her announcement of this Cushing's syndrome.
Right.
Let's start with that. What is Cushing syndrome?
And so it is a difficulty with managing the hormones in your body, but specifically the hormones that lead to us producing cortisol in our body. And hers seems to be exogenous, meaning it's not a problem with her body producing it, it's that she is receiving steroids outside the body as medications, and they are interfering with the production. And so it's causing an increase of cortisol because of medications that she's receiving either via her physician or for some other
I see. So it's a
condition.
consequence of something else going on in her body or treatment.
That's right. It's a
introduced to her
consequence
body.
of her treatment. She described it as exogenous. So it's a consequence of treatment. And how does this happen?
Yeah.
Oftentimes asthmatics may be on chronic steroids, or people with rheumatoid arthritis or inflammatory bowel disease or autoimmune disorders. There are many disease processes that require steroids as a part of the therapy to control the disease process. But here's one of the side effects. We don't see it commonly, but you can develop Cushing syndrome.
So what's her journey going to be like?
Well, presumably, they will begin to taper these medications. You cannot stop them cold turkey.
Okay.
So you have to gradually reduce the dosages of the medications such that she doesn't have any ill effects of being withdrawn from the medication themselves. But it can be a long and complicated journey and difficult to diagnose, as it seems to be with Amy Schumer. She saw multiple physicians, was not able to get to the root cause of what was happening with that. And yet people were noticing the change in her appearance. You can get a more rounded face, or you can get fat deposition in your shoulders, in your neck, and in your upper torso, or a fat deposit on your back between your shoulders. And presumably people were noticing these changes in her appearance as well.
Okay, we're going to wish her well on this journey.
Absolutely.
And now, former talk show host Wendy Williams, a lot of people were wondering, where is she? How's she doing? And now her family reveals that she's dealing with aphasia and frontotemporal dementia. These are two separate things. They don't always coincide with each other, but tackle for us aphasia. People have heard it more recently because Bruce Willis was diagnosed with having that. But what's going on with her, you think?
And so when you look at this frontotemporal dementia, it's sort of an umbrella term for a number of disease processes. We have two areas of our brain for language. One is called Wernicke's on the side of our brain, that temporal area, where we actually receive information, we receive language. And the other is Broca, which is in the front, the frontal area, where we produce language. This type of dementia impacts both, and so it damages the language centers, and you can have aphasia, meaning difficulty speaking. But it's not only difficulty speaking, you're also having difficulty understanding language. You no longer know the meaning of words. So this is how this can develop.
Yeah. So it's interesting because there have been clips that have been released of kind of a, a biopic series on her. Her family says that she was complicit and in agreement with this series, but then in her dialogue, she does seem to comprehend what is being said to her and seems to comprehend and intentional about what she's saying. Do you think that exhibits maybe the early stages of, or what's likely, our viewers to see or people to learn about her condition along the way? Does it only worsen and never really get better?
Fred, that's such a great point. As people watch this documentary or this film, there are 7 stages, starting with the early stage, going all the way to the final stages. And you will see that there will be progressive difficulty in utilizing language and understanding language. But what we generally see as a initial symptom are behavioral symptoms. People tend to lose social graces, have a loss of inhibition, maybe a decrease in personal hygiene. They can also develop obsessions, obsessive disorders like hoarding or inability to throw things away, touching objects within their environment, putting objects into their mouth. So
these is a huge process.
Inappropriate behaviors that are social behaviors that you may notice first in a person with frontotemporal dementia, as opposed to Alzheimer's. Alzheimer's generally presents initially with a memory loss, as opposed to frontotemporal dementia, or FTD, can present with behavioral issues first and language difficulties. So those are one of the two hallmarks that really can separate those two.
Oh, we're wishing her, she and her family, the best too, because this is going to be very difficult, as you just painted the picture. Dr. Jane Morgan, great to see you.
Thank you.
Thanks so much.
Pleasure.
Oh, and you are our last guest here in this building.
I'm closing it
the
down.
CNN Center, closing it down. We're not going anywhere as a program, but we are relocating to a completely new physical building, and we just had to let you know and let Dr. Jane Morgan know that you're our last live guest here.
I appreciate
so this is
the
a moment.
honor. Thank you. It is
Good
a
to see
moment,
you.
and I will just take it all in.
Yeah, and next time we see you, we'll be at a new
We'll
studio.
be in the new studio.
All right, very good.
Thank you.
All right, we'll be right back.